Hello, everybody. It's Monica Heltz with your Fishers Health Department COVID risk rating scale metric update. Today is Tuesday, December the 22nd. Our community transmission and our COVID risk rating scale right now remains firmly in red. In our risk rating scale, or severe risk for community transmission scale. Our community transmission metrics, the primary metrics we use are the percent positivity based on an individual's tested metric and a case incidence rate. Our county individuals tested percent positivity rate today is at 20.8%. It's been hanging about there for a couple of weeks now. Our Fishers Health Department percent positivity rates have been the highest we've seen so far in the pandemic. Right now we're at 16.09%. So 16.09% of the folks coming through our Fishers Health Department testing site are testing positive. So that's a bit higher than what we typically see through our site. Our case incidence rate is also remains very high. We're in the triple digits, and we've been there for the last couple of weeks in and out of it. So we're at 103.59 today. So all three of those kind of core major metrics are in red this week. So we remain in red. We'll be in red for a while because we're well over the limits that we set to go into red. Just to recap where we've been so far in the pandemic, we've seen more than 6,400 cases total. 652 of those were in the most recent 7-day reporting period, so from the 7th to the 15th of December. So that's more than 10% of the cases so far in this pandemic happened in a 7-day span recently. We also had 4 new deaths in that period, so that's a very short period of time to have that many deaths for our Fishers residents. We are seeing those numbers go up. For those of you that have been watching those numbers, early on in the pandemic, we had quite a lot of deaths in the nursing homes. And then we went for a good long while between June and September where we held steady at 35 total deaths, and those numbers have been rising since then, but they have not been rising as quickly as they have been lately. So we are definitely seeing the effects of this increased community spread in those numbers. So we now have lost 51 Fishers residents to the COVID pandemic. We also have new cases for the first 15 days of December is 43% increased above what we saw in the first 15 days of November. So we continue to see those increases. We continue to see that community transmission happening. So despite the fact that the kids, for the most part, have been out of school and we've put these restrictions in place, we continue to see increased community spread happening. So it is really, really important that everyone continue to wear their masks and distance and sanitize and not be gathering with people outside of your household. Our public health capacity is our secondary metrics that we look at. Our testing availability is quite good. We have seen an uptick in our testing over the last few days, but we remain having good availability for testing. So that is in our green category. You can get in the same day or the next day that you want to on either link, either through our Fishers Health Department link or the state testing site link. Our turnaround time on lab results is still in the 1 to 5 day category. It's fairly variable, but the average right now is 2.7 days for the turnaround time. So I'm going to put that in the green category this week. Our contact tracing remains strong. We have a lot of people working really hard to get you notified or attempt to notify you as soon as humanly possible. So we're going to put that in green. For our Fishers Health Department side, I'm going to leave the state health department contact tracing efforts in orange, but they are making significant improvements in that process. Our hospitals are in our orange category. They remain stretched. They have done some shuffling with their staff. They've done shuffling with what surgeries they're having, who's appropriate for surgeries. And so those have allowed our ICU beds to be relatively stable. And we have currently 19.8% of our ICU beds available. That's been bouncing between 18% and 23% in District 5. But what we have seen is that percent of COVID that's in the ICUs is increasing. So we suspect that's due to a lot of the shuffling the hospitals are having to do in order to manage their staffing challenges and make sure that they have space available. December the 16th was a record day for COVID hospitalizations in District 5. There were 1,018 people hospitalized with COVID in District 5. So we do continue to see those strains on the healthcare system. So So that's where we're at. We have great news on the horizon with the vaccine. Our healthcare providers are starting to get vaccinated. We have 40,000 Hoosiers who have received the vaccine so far. We're still working through our healthcare providers on the front lines, and they're getting ready to start long-term care residents next week, and then we'll be rolling forward based on the recommendations after that. The state and the national stage are still finalizing some of those recommendations. The Committee on Immunization Practices just published those, and then the state will have to decide how they want to uptake them. We are ready, and we have developed a vaccine interest survey that you can look on our website for tomorrow. We'll have the link up for you, and you can express your interest in receiving the vaccine. That doesn't mean that we have it yet. We do not. We're not expecting to be able to offer it until somewhere in the neighborhood of January 11th. But you can express your interest and a few risk factors that will allow us to meet those categories that have been laid out. And so when they decide who's next, we can then send you an email to say, hey, your time is come and you can register now. So that's the hope with that vaccine interest survey. We also did put out some new orders today, so you can look for more information on that on our website. The basics of the orders are that we're closing restaurants and bars to in-person dining and drinks and service between the hours of 10 p.m. and 5 a.m. for a period of 2 weeks. So it's not a complete closure, it's just closed from 10 p.m. to 5 a.m. For a period of 2 weeks. So that's what the new orders say. It goes into effect Christmas Day at 10 p.m. So you can look for that news, and if you want any more details about that, see our website and you can read the orders. Thanks so much for listening. Stay safe out there. Be careful. Goodbye.